Most of the time, a shoulder replacement can be done as an outpatient procedure. By that I mean that a surgery can be done, like say for example in the morning, and that afternoon the patient can be done with the recovery process and head home. Now, and sometimes we do this surgery in a hospital setting, but still, most of the time, the patient can be discharged the same day or the next morning after surgery. The reason for this is that the anesthesiology team is able to place a nerve block which causes the whole shoulder to fall asleep so that when you wake up, you aren't waking up in a significant amount of pain. Now, of course, the nerve block wears off after about 20 to 24 hours, and so we do prescribe some pain medication for patients to start taking. They usually start, even though they're not having pain, they will start taking it the night of the surgery and continue. Usually days 2 and 3 are the worst after surgery, but quickly after that, the pain starts to normalize and patients find themselves being able to taper themselves off of the pain medication. After surgery, most people are in a sling for the first 6 weeks. It has mainly to do with kind of remembering the restrictions that go along with having the surgery, the shoulder replacement. The specific restrictions are that when we do the surgery, we detach this tendon in the front called the subscapularis, and that allows us to do the replacement. And at the end, we sew it back together, which allows the tendon to grow back to heal to its native footprint. Now, of course, that tendon is very important for the functioning of the shoulder replacement, so it's really important that patients protect that tendon. It takes about 6 weeks for that tendon to heal. So the restrictions are you cannot use any forceful internal rotation of the shoulder, so outward to inward motions such as chopping on a cutting board or tucking in shirts or rubbing on your chest or your face. Those would all activate that muscle, which could then potentially compromise the repair. But after that first 6 weeks and after we verify that the tendon is healed, we generally let patients start to do anything they feel like doing. Although most patients will tell you it takes about 3 to 6 months before they really feel ready to get back out on the golf course or lifting weights. But at that point, usually by the 6-month point and beyond, they really don't think about the shoulder. They start to think of it as a normal part of their body, and they tend to regain their maximum functionality.